COVID-19 hospitalizations have hit a record high in the U.S. as the virus rages across the nation. Daily virus cases hit a record 136,000 new infections on Tuesday. Over 1 million of the more than 10 million confirmed COVID-19 cases in the country have come in just the first 10 days of November. The government's top infectious disease expert, Dr. Anthony Fauci, says he believes the FDA will approve Pfizer's vaccine. That is good news. He said a vaccine could be widely available by April. Now, Texas is one of the states facing a massive rise in coronavirus cases. It's become the first state in the U.S. to surpass 1 million confirmed coronavirus cases. Janet Shamlian joins me now to break down the shocking numbers there in the Lone Star State. Hi, Janet. Thanks for being with us. So what has led Texas to this unimaginably high number of infections? I mean, you think of the Lone Star State and you think of lots of wide open spaces, pretty easy for people to socially distance. Is this happening mostly in urban centers?
That's an excellent point. You do think of Texas in these wide open spaces, but in fact, our population is just short of 29 million. So that has a lot to do with it. And we've learned that COVID disproportionately impacts minorities. There's a large Hispanic population here in Texas. People who have lack of health care, especially in some parts of the state here, so that's another factor. And I want to put that million number in perspective for you. More than 1 million cases in Texas. That's more than the country of Italy, which was considered a hotspot before the lockdown. And if Texas were a country, that number of more than 1 million would be in the top 10 of countries. But getting back to your initial question, there's multi-generational families here. There's a lot of higher education with younger people circulating. So you can't really pin it on one thing. It's a combination of factors, but you would have to say that the fact that our population here is so large, that has a lot to do with it. And here in El Paso, it is really the epicenter of the state right now.
You don't know this, but El Paso is my childhood home, so I'm very sad to hear what's happening in the city there. What are hospitals all across Texas, and there in El Paso particularly, doing to manage this overwhelming number of coronavirus patients?
I did not know you were from here, and there are a number of really great hospitals here. I'm standing in front of the University Medical Center, which you may be familiar with. And last night, our team watched as ambulance after ambulance pulled up with people on stretchers, and they would go into these makeshift tents that have been set up in front of the hospital, a COVID triage, if you will. And I was so surprised to see that one tent had been set up just for infants and small children. So they're trying to manage the surge, all the hospitals, by adding additional facilities. Unfortunately, they've not been able to handle everyone, and in some cases, they have sent patients as far away as San Antonio, which, as you know, is more than 500 miles away. It's really more than they can bear in El Paso County right now.
Absolutely. And is the state overall doing anything to try to stop this dangerous surge in infections? How is the state responding? It is a huge problem in El Paso, but is the state responding to help the city?
So it's always a statewide issue, right? But it's happening locally. And Governor Greg Abbott has been resistant to putting any kind of lockdown in place that would affect the entire state. That would be highly challenged here in a state where people do their freedom. That said, the governor has sent in medical teams from the Department of Defense, from the Air Force, to El Paso, and cities are the ones that have really taken the lead on this. So, for example, in El Paso County, the county judge issued a 2-week lockdown for the county, meaning all non-essential businesses have to close. That is supposed to end today, but because the numbers have not gone down here, the judge is threatening to expand that lockdown order. Some cities have put curfews into place, and these are moves, Tanya, I have to say, that are in the interest of public health, but have been highly resisted by people who work in these places. They say, look, we have got to get back to normal. So it's a push and pull here between individual freedoms and the health of the citizens.
Absolutely. Janet Shamlian in El Paso, Texas, thank you so much.